This is RTV6 News at 5:30, working for you.
Tonight here at 5:30, it's been a lifeline for Hoosiers and people all over the country. The extra $600 in unemployment benefits that run out today. Now what? The program stepping up to help people keep their homes. And inspiring girls to aim high. A doll, the Children's Museum, and real role models combine efforts to show young women there's no limit to what their futures could hold. We'll have those stories here at 5:30.
All right, here's a look at our lineup on this Friday. Colleges are looking at testing as they think about bringing people back to campus, but there is a question about just how often they would have to do it. We're going to take a look at a model that could potentially work. And there's already a nationwide school nurse shortage. Now you add in the pandemic, how schools are working to address this problem to keep kids safe. And the pandemic may be bringing attention to an issue that some women have been facing for a while, why their health problems, potentially even COVID-19, are being dismissed.
And first here at 5:30, a record number of families could be at risk of experiencing homelessness as the additional $600 a week in unemployment benefits ends today, and the eviction moratorium is set to expire in just 2 weeks. RTV6's Megan Sanctorum found out how a local organization in Hendricks County is stepping up to help keep hundreds of people in their homes.
Paying rent and utilities is becoming increasingly difficult for many families in Hendricks County. That's why one organization is stepping up to help and working to prevent homelessness.
I had no more work, no money coming in. I had nowhere to turn.
Brian Reeves is just one of many who lost their job due to the pandemic.
It was scary. It was the scariest thing I've ever done in my life. And I had my daughter, and that was the only thing I could think of.
Reeves was living in a hotel with his 2-year-old daughter, Ivy. But without working, he wasn't able to pay his bills and was about to be evicted. He's not alone.
In the last 30 days, the level of need and the desperation has been astronomical.
Julie Randall is the executive director at Family Promise of Hendricks County. They work to help prevent homelessness by providing emergency housing and things like rent and utility assistance. She says during the pandemic, they've been helping around 180 families a month. But this past month, the need was unlike anything they've ever seen.
308 families this month have already received assistance from Family Promise. And a lot of that assistance is in the form of rent or utilities or clothing or car repairs or transportation, food.
She says the coming months could be even worse, but they're ready to help hundreds more through their Powerhouse project, which is made possible due to a $100,000 grant from Impact 100.
We've prepared all of these funds and all of these, our staff for the onslaught that we know is coming. I mean, we call it a tidal wave of evictions and homelessness that's on our way.
And she says sometimes this little boost is all families need to get back on track.
They gave me every tool I needed to get the job done. I have my pride back. I have my dignity back. I don't have the worries that I had before this.
Working for you, Megan Sanctorum, RTV6.
And if you're interested in learning more about Family Promise and their Powerhouse project, you can head to our website at theindychannel.com. Kyle.
And Mark, we are wrapping up a pretty nice day here for the week, especially after yesterday was so soggy across much of central Indiana. But we do have some rain showers that have already returned to the area, and you can see that with temperatures where we've got some rain-cooled 70s, especially across portions of Monroe County. Bloomington right now coming in at 76 degrees, while it's 80 in Indianapolis, 82 in Lafayette and Muncie. And temperatures will hold fairly steady here as we go through the evening. We're still in the middle 70s through 10 o'clock with a couple of those showers. Storm Team 6 radar shows you where we have that wet weather developing, and it is fairly light. It will continue to spread toward the north here as we go through the evening. You can see along I-70, and then it stretches into Bloomfield. Also, some of that wet weather about to make its way into Martinsville, and some very light rain around the Columbus area. Bigger picture, though, does show that we've got a complex of rain that is sitting off to the west, and all of this back around the St. Louis area is going to be sliding our way and impacting your Saturday. In fact, our rain chances go up, and they are going to be pretty high throughout the day on Saturday. Coming up in a few minutes, we'll take a look at TrueCast and help you plan that weekend. Chris?
All right, let's take a look at the news feed. Georgia is now turning one of the largest convention centers in the U.S. into a makeshift hospital. The Georgia World Congress Center in Atlanta will reopen on Monday with beds to treat COVID-19 patients. They'll begin with 60 beds and add more if needed. More trouble for baseball. Today's game between the St. Louis Cardinals, Milwaukee Brewers, it's been postponed. Multiple Cardinals testing positive for COVID. The U.S. Tennis Association is still preparing for a U.S. Open this year. The event is scheduled to begin in late August in New York. The Tennis Association plans on releasing its health and safety plan closer to the start of the tournament. The nation's top health officials back on Capitol Hill today to discuss a plan for moving forward from COVID-19. Dr. Anthony Fauci says he remains cautiously optimistic that we will have a safe and effective vaccine widely available next year.
I don't think that they will have everybody getting it immediately in the beginning. It probably will be phased in. And that's the reason why we have the committees to do the prioritization of who should get it first. But ultimately, within a reasonable period of time, the plans now allow for any American who needs a vaccine to get it.
Fauci pointed out that we're already taking a financial risk right now in developing doses, so we'll be ready to distribute it. Fauci does not think that we'll have to rely on other countries for a vaccine because we are moving so quickly. And he noted that no safety steps have been eliminated in the approval process. Now, Dr. Robert Redfield urged schools to follow CDC guidance in reopening. He says during this crisis, we can't forget about other health repercussions brought on by closing schools. Redfield thinks a drop in child abuse reports is a direct consequence of kids not being in school, where many of those reports are normally brought to light. And he says kids get access to food and mental health services at school, too.
I do think it's really important to realize it's not public health versus the economy about school opening. It's public health versus public health of the K through 12s to get these schools open.
Redfield also answered questions about the change in hospitals reporting data to the Department of Health and Services, bypassing the CDC. He testified that he wasn't involved with the decision, but he agrees with it. Both Redfield and Fauci reiterated the need for simple measures to stop the spread of this virus, like wearing a mask, washing your hands, and physical distancing. Let's get back to our lineup. Colleges are looking at testing to bring people back to campus in the fall. We have a look at the new model for testing and just how much it could cost.
Inspiring girls to chase their dreams and be anything they want to be. The Children's Museum of Indianapolis and Barbie are teaming up for a new exhibit that opens to the public tomorrow called You Can Be Anything, The Experience. Over the years, Barbie has shown girls that they have choices about what they want to do in life. And this new exhibit will help them explore the possibilities. Thinking about a career in aviation? Look no further than Amelia Earhart. Mathematician and physicist? Well, there's Katherine Johnson, one of NASA's own hidden figures. For the athletes, there's Olympic gymnast Lori Hernandez and so much more. Children and their parents will see images of real-life women, learn their stories that led to their success, and see the Barbie dolls that represent them.
We're hoping to show them there's many career opportunities out there for them. So throughout the exhibit this weekend, they can go see 11 different careers they can try on. They can see role models that help inspire them in their journeys. Then also they can see over 60 dolls that hopefully can help inspire their future conversations for careers.
Barbie has had more than 200 jobs over the last 60 years. The exhibit will help children to discover her diversity as well as what role might fit them best in pursuing a career. This exhibit opens tomorrow and runs through the spring of 2021. If you head to the Indianapolis Zoo, you might just catch a glimpse of the newest resident. Check this out. This is a greater kudu calf. She was born in the early morning hours of July 20th to mom, JoJo. Mom and daughter have recently started venturing out together in the plains area of the zoo. The calf doesn't have a name yet. She weighed about 33 pounds at birth. Greater kudus are among the largest antelope species.
Colleges are trying to figure out how students can safely get back to school. More schools are choosing to go online only for the fall. For those that will have students on campus, a big question is how testing could work. This week, Maryland state universities are some of the latest to say they will test students if they can't prove they had negative test results within 14 days of arriving on campus. Researchers from Yale, Harvard, and Mass General Hospital have a model of what they say needs to happen for campuses to reopen. It includes testing students every 2 days, along with strict social distancing guidelines.
There are schools out there that are still thinking that they can get by simply with symptom-based monitoring. That is to say, waiting until a student develop symptoms before springing into action. We have run simulations and scenarios over and over again. We have yet to find a single one where that is good enough.
They believe screening frequency is more important than test accuracy, but they say daily testing could lead to false positives. They think testing every 2 days will cost $470 per student per semester.
Any school that cannot reasonably see how it's going to implement a program of frequent screening alongside a program of social distancing really has to ask itself if it has any business reopening.
Vassar College's president did look at this model to see how it would work for her school. She wrote in the journal JAMA Network Open that they would have a controllable number of infections even if they only tested students every 4 weeks. Now, they would also use social distancing, masks, and contact tracing. Students would need a negative COVID-19 test before they moved in. Now, the CDC doesn't recommend entry testing for everyone returning to campus, but it says in areas seeing more cases, they should consider testing all or some asymptomatic people without any known COVID exposure. All right, ahead in our lineup, school nurses will play a critical role in the reopening of schools, but that could be in jeopardy. How they're trying to address a nationwide school nurse shortage amid the pandemic. The tally is quickly adding up on what the government is paying potential coronavirus vaccine makers ahead of actual approval. More than $3.5 billion at this point. Now, the latest two companies to get money teamed up earlier this year to develop a vaccine. Then a few weeks ago, 2 more companies were paid to start manufacturing. Now, between the 2 deals, there are some 200 million guaranteed doses, but that's only if the vaccine passes FDA regulations, which could get fast-tracked.
We'd look at the data from the accumulated phase 1, phase 2, phase 3 trials. If they met the criteria we put in our guidance with respect to safety and effectiveness, we would consider using an emergency use authorization if we felt that the risks associated with the vaccine were much lower than the risks of not having a vaccine.
The FDA commissioner admitted if the vaccines don't meet criteria, it's money lost. The standard the FDA set is a vaccine needs to be at least 50% effective.
What we want to see is either a reduction in the severity of the disease. So, Howard, very simply, from a disease that could be lethal to a disease that's like the common cold and not lethal. That's an okay clinical outcome. I think we as doctors can all agree that's great.
Now, he says he's encouraged by the diversity in people signing up to participate in trials, saying so far 19% are African American and 19% are Latino. It's not clear where things stand for pregnant women, the elderly, and children.
We have very clear data from the CDC that children tend not to get ill from the disease, although a small fraction of them do develop this post-infection inflammatory syndrome. And the big concern there is, would a vaccine elicit that?
Now, the FDA says a silver lining so far in vaccine development is that it's forced them to look at data earlier as it comes in, as they go, rather than when the trials are complete. Now, the process is something they will consider permanently for other medical products. All right, let's turn to the news feed. Twitter thinks it knows how hackers were able to cause that major breach recently, and all it took was a phone. Hackers fooling the company's employees into giving them access. Former head of the KKK is off of Twitter. Company banning David Duke for violating the platform's rules on hate speech. Now, some companies are ending their boycott of advertising on Facebook. North Face says it is encouraged by recent talks with the social network. Companies left over concerns that Facebook isn't doing enough to stop hate speech.
And we are going to be seeing that active pattern of weather returning. So dry weather today, not necessarily a bad thing. We already have a few of those showers returning, and I think they'll increase in coverage here a little bit tonight. But mainly some light rain. Temperatures overnight dropping back into the middle 60s for us with a light east breeze. And then our Saturday forecast, rain and the weekend doesn't really go hand in hand all that well. So you might want to make those indoor plans tomorrow, because I do think we're going to have more soggy hours than dry time. And that's going to keep those temperatures only getting into the middle 70s across much of central. Another cool day of weather. As we check out TrueCast, you can see a few of those scattered showers will start off the day. As we go toward lunchtime, may mix in a few rumbles of thunder as well, and that will continue to be the case into the afternoon and evening hours as well, especially south of Interstate 70 for us. And even as we go into tomorrow night, we still have some areas of rain and possibly a few thunderstorms in the mix. Potential, some areas, especially if you get under a couple of those thunderstorms, could be over 2 inches of rain. Most areas will be about an inch or two as to what we see to start off the weekend. Sunday, a little more dry time. Still think we're going to have some wet weather as we go into the afternoon. And as we check out things going a little farther in time here, we are going to have some improving weather with temperatures only in the 70s. We'll look at that 7-day forecast in a few minutes.
A school nurse shortage in the middle of a pandemic. Sound like a problem? Public health officials say it is, especially as parents consider how to send their kids safely back to school. Chris Conti continues our series of reports with a closer look at what might happen at your child's school if there isn't a nurse to be found. Of all the equipment you might find inside a school nurse's office, nothing compares to the value of the school nurse themselves.
Is it safe to return to school?
Linda Mendoza oversees the National Association of School Nurses. As she thinks about empty classrooms beginning to fill back up with students, she can't help but be filled with anxiety.
We don't have a roadmap for this. And so I think when you don't have a roadmap, that makes it a little more challenging.
School nurses will be playing a critical role in the reopening of schools. They're being asked to monitor kids for COVID symptoms and, in some cases, help health departments with contact tracing if an outbreak occurs at a school. But a nationwide school nurse shortage puts a lot of that in jeopardy.
In the midst of a pandemic, there should be a school nurse in every school. And there is not.
Nationwide, 25% of schools will be starting the year without a school nurse, a statistic that is particularly troublesome to health officials in the face of this pandemic. What's driving the school nurse shortage? For starters, pay. The average school nurse makes about $46,000. There's also a simple funding problem. School nurses are often the first to get cut when districts need to eliminate positions. The need is so great that the National Association of School Nurses is advocating for 10,000 new nurses in the next federal stimulus bill.
How will we reduce transmission of illness if we don't have nurses there to assess COVID-like symptoms?
Jenny Gormley and Doreen Crow are both school nurses in Massachusetts.
And the essential role of the school nurse is so important. That there needs to be a full-time nurse in school every day at all schools.
Their hope is that in the face of this pandemic, districts across the country will find ways to support nurses with both PPE and funding.
We all want students back learning face-to-face and in the buildings, but we want to do it safely.
There's a lot of unknowns in all of this, right? It changes day to day.
As parents attempt to send their kids safely back to school, school nurses will be one of the best prescriptions for success. I'm Chris Conti reporting. Chris, thank you. Let's check the news feed. Democrats are raising questions about the president's negotiating skills. House Democrats putting out a new report saying the White House overpaid for ventilators by $500 million. The White House did not immediately respond to that. Doctors are recommending a drug for COVID-19. It's not a strong recommendation, though. In journal BMJ, doctors say remdesivir, it can help in severe cases, but they say the evidence is low that it can work and more studies are needed. Airbnb suspending dozens of rentals in New Jersey. The state's governor says house parties are linked to a rise in cases there. Airbnb suspended 35 rentals. New research is showing how it might be best to arrange a classroom to prevent the spread the least amount when it comes to a virus. University of Minnesota researchers looked at how aerosols would travel in a typical classroom, a 50-minute simulation with an asymptomatic teacher consistently talking. It determined that only 10% of the aerosols were filtered out. The majority were instead deposited on the walls. And when the teacher who was asymptomatic stood directly under an air vent, the aerosols spread a lot less. Now, unemployment levels are at a historic high, but one American town is actually seeing the opposite. According to the Labor Department, the unemployment rate in Owensboro, Kentucky has not gone up over the past year. The largest employers in Owensboro, healthcare providers, bourbon and tobacco producers, and those who make PPE. Well, your mail may not arrive on time. That is because the post office is dealing with a backlog of about 2 days. Postal Service put in cost-cutting changes last month that cut back on OT and shut down sorting machines early. Letter carriers also have to leave mail behind if it means an extra trip or a late delivery. All right, finally, in our lineup, the pandemic may be bringing attention to an issue that some women have been facing for a while now, why their health problems, potentially even COVID-19, are getting dismissed, and how you can have a better experience at the doctor. It is a harsh reality for women's health care. Doctors often dismiss their symptoms, saying they don't need to be taken seriously.
Women often get told that it's hormonal, maybe it's in their heads. And women, after a while, when they hear that repeatedly, they start ignoring symptoms and don't seek the care that they often need.
Now, that's not expected to change during this pandemic. Medical experts say it may highlight this problem that women face, especially because doctors are learning new things about coronavirus symptoms every day. Now, historically, there hasn't been as much research in how diseases affect women differently. So doctors may not be aware of certain symptoms in women. And that's why Dr. Stacy Rosen says that women should prepare before an appointment. They should look at their medical records and also find a provider that they trust.
If the one you're working with, doesn't have a good relationship with you, you're not comfortable, find somebody else, get a second opinion. So being an advocate is the first thing.
There has been more research in how women are affected differently by illnesses in the past decade, and Dr. Rosen says this needs to be the norm. And there are some new guidelines to tell you about when it comes to cervical cancer screenings. The American Cancer Society suggests that patients do an HPV test instead of a Pap test every 5 years. Testing should begin at age 25 and go until age 65. Women's healthcare offices without HPV testing may continue with Pap tests. Health experts are seeing more and more people needing medication during this pandemic to help them fall asleep. Monday, we'll have 3 things experts say that we can do to battle what they call pandemic-induced insomnia.
And we are going to have a little better dry time on Sunday, so a better chance there of getting your outdoor activities in, because on Saturday, we are going to have some fairly widespread rain and a few thunderstorms. Temperature is going to remain on the cooler side for this time of year, as we'll have another round of widespread rain going into Monday. Things begin to dry out, though, by the middle of next week with lower humidity and highs only in the 70s. Thanks for joining us at 5:30. The news at 6 starts now.